Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome John Thomson Smith. He's a physician executive. Today's Kevin MD article is Biomarkers, how to manage your body's key performance indicators for longevity. John, welcome to the show.
Thank you, Kevin. Thank you for the invitation. It's a pleasure.
All right, let's start by briefly sharing your story and journey.
Yeah, sure. Well, I'm actually an orthopedic surgeon by trade, and have spent 20 years in clinical practice there in the UK, in the NHS and private sector. And during the pandemic, I started doing a lot more corporate work because we stopped operating for nearly 2 years with no anaesthetists and nursing staff. And I found myself working a lot with implant device companies in terms of product design, trying to have a greater global impact for the patient. And one of my personal interests is in the longevity space and sports medicine and healthy lifestyle, nutrition, etc. So I found myself working with a company called AI, who are a decentralized data platform. It's a phone app application, and we're about to launch the definitive app any moment now. So it's a very exciting time, and we're using AI-driven insights, a decentralized data platform to improve patient lifestyle and longevity. Hence the article. And I'm a senior medical advisor at the.
All right, so talk about your Kevin MD article, how to manage your body's key performance indicators for longevity for those who didn't get a chance to read it.
Yeah, sure. Well, there's certainly a lack of knowledge globally, both for physicians and patients alike, in terms of biomarkers, whether they're physiological biomarkers such as your VO2 max or your variable heart rate, and along with molecular biomarkers such as blood test analysis and blood profiling. And this is obviously a very hot topic at the moment with the advent of wearable devices and sensor technology. We've all got smartwatches, and these are key markers in terms of our health span and longevity. And it's a real pleasure to publish the article. And one of the aims of the company at the moment is really to increase awareness globally in terms of what we should be doing and the metrics that we should be tracking. So yeah, it's a real pleasure to be involved with this space.
All right. So you mentioned a few of these biomarkers in passing, VO2 max, heart rate variability. So talk about some of these important biomarkers specifically, what they are and why we should know about them.
Yeah, absolutely. Well, some of them are more easy to measure than others. So on a standard Apple Watch or Garmin, you will be able to assess your resting heart rate. You'll be able to assess your respiratory rate on some devices such as the Whoop strap. More involved biomarkers such as VO2 max may need some specialist testing, for instance, a treadmill test or cardiovascular assessment. And our aim with the app is actually to encompass all of these biomarkers into one usable app so that you can upload your blood profile, such as your blood glucose test, your cholesterol levels, your chronic inflammatory markers, and roll that together with the physiological markers and even genetic testing, give you a much accurate idea about your biological age and longevity.
All right. So let's say we have a standard Apple Watch and we want to measure our heart rate variability, for instance. So tell us what kind of medical prognosis or predictions one can make specifically from that marker.
Yeah, great question, Kevin. Well, there's vast evidence now that high VO2 max or increased heart rate variability, or indeed even a low resting heart rate, is intrinsically associated with increased longevity. And the reason why this is important is that if we have an awareness that these metrics could be improved, then we can monitor and track these and potentially improve our health span and lifespan. So it's really raising awareness of these markers, but I can't emphasize enough, it's really the monitoring and the tracking of the trends associated with those markers that is important for each individual.
Talk about the evidence and some of the data behind that. Do you have any numbers that perhaps you can cite in terms of how much longevity one can gain if they have a favorable heart rate variability or a favorable VO2 max, for instance?
Yeah, absolutely. I mean, in terms of anecdotal data, there is very good evidence that improving your VO2 max or heart rate variability or improving your resting heart rate can certainly reduce your biological age. And, I mean, a great case example would be the very famous Brian Johnson, who works in the longevity space and is the subject of a current Netflix documentary, who actually reduced his biological age between 5 and 7 years by improving his VO2 max and his cardiovascular parameters over a 1 to 2 year period. And all of the evidence points towards the metrics improving one's longevity.
And for those who aren't familiar, just give us a 10 to 15-second primer as to what VO2 max is.
The VO2 max is essentially the maximum oxygen consumption or maximum oxygen carrying capacity of an individual during high intensity exercise. And it's traditionally been associated with athletic performance, and it's certainly common in elite sports for people to have their VO2 max measured. But it is actually the number one key parameter in terms of physiology and predictors of lifespan.
Are there any other biomarkers other than the ones we talked about that patients can measure themselves with commercial wearable devices?
Yeah, absolutely. I mean, a common example now would be your blood glucose level. So your blood glucose level and your insulin sensitivity is directly proportional to chronic inflammation systemically, which means high chronic inflammation for an individual can be detrimental in terms of your health span and longevity. So monitoring your blood glucose and making sure that that is within normal ranges is very, very applicable and also accessible now with modern techniques. So that's one that certainly springs to mind, along with the other ones that we've discussed. And another very interesting product that is currently on the market is the Oura Ring, which has really gone to town on sleep hygiene and sleep health. And that is often a metric that is forgotten in one's lifestyle, but absolutely crucial for repair and regeneration at a systemic level. So I really like what they've done with the Oura Ring. But it's really tying all these metric things together and trying to create a complete package for that individual in terms of personalized care.
Now, you're a physician and a medical advisor, of course, to a company. So what are you recommending patients do? Are you recommending patients get these wearable devices and measure all of these biomarkers? How many devices would they have to buy? What are you recommending for the typical patient who may be listening to you now, who wants to be a little bit more conscientious about measuring some of these biomarkers we're talking about?
Yeah, it's a great point, Kevin. And I think it's overwhelming, isn't it, at the moment in terms of the devices that are available. And what we've tried to do at Rejuve is allow access or connectivity to any of those devices. So if an individual was to buy a Garmin or a Fitbit or a Whoop strap, that is inherently compatible with the app on your phone. So you connect your wearable device, and with that, you can input any data you wish. So if you've had a recent blood profile at your family doctor or your GP, you can input that data, and this will give you a more rounded picture in terms of your biological age and longevity. So in answer to the question, I would advise an individual who's new to this to start slowly, just stick to one device and one app, because you could end up with 4 or 5 different applications or 4 or 5 devices. So my advice would be to stick to one device, one wearable device that is easy to use and good functionality, and one application on your phone that you could use, and just keep things simple initially.
Now, of course, there are biomarkers that are measured through the blood. So I'm a primary care physician here in the United States. What are some biomarkers that perhaps I should be thinking about for my patients I see in the exam room in terms of ordering specific blood tests or just having these biomarkers in the back of my mind if I wanted to promote longevity in my patients?
Absolutely. So I think we can break that down into more common sort of household names in terms of testing. So we already mentioned blood glucose, lipid profile is crucial. So the ratio of your good and bad cholesterol, the HDL and LDL, inflammatory markers such as CRP or IL-6 or ESR in certain cases. These are acute phase genes which give us a good indication in terms of chronic inflammation. And also hormones play a crucial part in longevity as well. So, our sex hormone levels, whether it's testosterone or estrogen, as well as your sort of resting cortisol levels in terms of stress hormones as well are important. So let's not forget about endocrine function. And along with that goes thyroid testing as well. And of course, the list is endless in terms of blood tests that we could request at a family doctor level. It's mind-boggling, but they would be the most important ones. And more contemporary tests now do offer chronic inflammatory markers for biological age assessment and genetic profile. And this is something that's very close to my heart at the moment, trying to make those genetic tests more accessible, affordable, and easy to understand for patients. But I think that over the next 5 to 10 years, we will see a real boom in genetic and epigenetic testing for patients to identify key parameters so that we can institute changes in lifestyle and interventions in view of preventative health rather than treating disease.
Now you mentioned over a dozen tests there. So do you recommend like a blanket approach? Do you recommend targeting some of these tests based on the risk profiles of the patient in front of you? How would you approach these scores of biomarkers that you just mentioned?
Yeah, I think certainly it comes down to this precision medicine, or what I would call a tailored approach to each individual. So if you're faced with a 16-year-old adolescent, that is a very different situation to a 75-year-old male. So I think we need to be aware of which patient is sat in front of us. It may not be appropriate. There may also be an element what the patient has requested and how much you want to do a deep dive into this. And I think you could really break that down into a more basic assessment of biomarkers, or a full thorough gamut across all of the tests, including the genetic profile and the epigenetics. So I think really, to answer the question, Kevin, it would be a tailored approach to each individual.
So give us some successful case studies of how some of the patients that you're seeing or that your company is seeing is successfully integrating biomarkers into their lifestyle and how that's positively moving the needle in their life. Give us some examples of what your vision would be like in an ideal case.
Yeah, that's a good point. So we've currently got around 10,000 users on our beta test app, and as I say, we're going to be launching the definitive app in the next few weeks. So what we found is that the monitoring, the tracking of the biomarkers and the health status of the individual provides a motivation factor in terms of seeing progress, whether it's with a body mass index, whether it's with a metric such as was mentioned as VO2 max, whether or not it's a biological age tracker with improvements in that. It's really that monitoring of the progress that we've seen is the key motivating factor. And we've seen big changes in individuals even within 30 days. And the goalposts seem to sit around 30 days, 60 days, and 90 days, or 1 to 3 months in terms of improvement. But it's really that feedback as well that is given through the application, through the artificial intelligence and machine learning models that are given. So you can actively monitor the progress and institute sort of almost real-time changes to that person's lifestyle. And that's really a sort of blanket approach to what we've seen within the app and the feedback that we've had. And we've found that people have remained within the app and want to continue to see that progress and improvement, which is really, really exciting.
We're talking to John Thomson Smith. He's a physician executive. Today's Kevin MD article is Biomarkers, How to Manage Your Body's KPIs, Key Performance Indicators for Longevity. John, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yeah, great. I mean, on a personal level, I would say for the physicians out there, keep your options and your horizons open. Don't become very easy to become blinkered in your own clinical pathway and not see the bigger picture. And we can have a much bigger global impact in terms of contemporary medical technology and incorporating these things into our practice. and the real take on message is to really try and focus on preventative health rather than treating disease, which is the way that we've been brought up as physicians to to treat the sick. But it's really looking at those precision medicine, personalized health plans, and prevention is better than cure, and that's really what we're striving to do here at Reduce.
John, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thanks for the invitation, Kevin. It's a pleasure.